everyone and welcome back to my channel. Myself Dr. Surabhi Sahney and you are watching Dr. Surabhi Sahney dental series and medical videos. Today we are going to talk about the solved paper of the Neet MDS of the year 2019. So without wasting time, let's get started. If you haven't subscribed to my channel yet, then please do subscribe to my channel by pressing the button subscribe and don't forget to press the bell icon. The importance of bell icon is that you can have the notification of my upcoming videos. Already there is one playlist with the name Neet MDS. You can check out that playlist and find out all the previous year question paper with the solutions. Let's begin with the Neet MDS paper solved questions of the year 2019. Begin with the first question. Here it goes on your screen. Drug of choice for anaphylaxis is option A, adrenaline, option B, aminophylline, option C, prednisolone, and option D, oxygen. So what do you think what will be the right answer for this question? Here the right answer is option A, that is adrenaline. If we talk about the management of the anaphylaxis, then here is the total treatment regarding the management of anaphylaxis. You have to identify the anaphylactic reaction, then remove the allergen if it is still present, followed by you have to activate the emergency medical services. Then place the patient in the supine position, and if breathing is quite difficult, then allow them to sit. Assess the ABC, that is airway, breathing and circulation. After that, you can also give the intramuscular injection of epinephrine, which is in the ratio of 1:1000. That is 0.3 to 0.5 milligram without any delay. Repeat every 5 minutes if needed. With the second question, here it goes on your screen. Antidote for heparin is option A, protamine nitrate, option B, protamine sulfate, option C, vitamin K, and option D, antiheparin. So what do you think what will be the right answer for this question? Here the right answer is option B, that is protamine sulfate. You can check the list of the drugs along with the antidote, which is shown on your screen. Begin with the third question. Here it goes on your screen. Which of the following is cardioselective beta blocker? Option A, carvedilol, option B, acebutolol, option C, labetalol, and option D, pindolol. So what do you think what will be the right answer for this question? So here the right answer is option B, that is acebutolol. Here is the list of all the beta blockers which will definitely acting exclusively on the myocardium. Begin with the next question. Here it goes on your screen. Which describe how to best assess a fractured palatal root that has been displaced into the maxillary antrum area during the extraction of a maxillary first molar. Option A, through the hard palate in canine area. Option B, through the canine fossa above the premolar roots. Option C, through the nasoantral wall above the middle concha. And option D, via extraction site of tooth by enlarging the oroantral area. So what do you think what will be the right answer for this question? The right answer is option B. You have to go through the canine fossa above the premolar area, above the premolar roots. Begin with the next question. Here it goes on your screen. Akshay is having a research on plasmodium species. For the same, he needs to visit Odisha for 5 weeks. Which of the following drug need to be taken as prophylaxis before going to malaria endemic place? Option A, artesunate. Option B, mefloquine. Option C, doxycycline. And option D, chloramphenicol. So what do you think? What will be the right answer for this question? Here the right answer is option C, that is doxycycline. Begin with the next question. Here it goes on your screen. A 19-year-old college student has a well-controlled asthma, but on reporting to the college health clinic, complains of a sore throat. On examination, he has typically the signs of thrush, a fungal infection with candida albicans. The asthma controller medication most likely to be associated with candida infection is option A, theophylline in long-lasting oral form. Option B, prednisone by mouth. Option C, impratopium by inhaler. And option D, beclomethasone by aerosol. So what do you think? What will be the right answer for this question? The right answer is option D, that is beclomethasone by aerosol. Begin with the next question. Here it goes on your screen. A patient present to your office needing a removable partial denture fabricated. The floor of the mouth is 6 mm to the free gingival margin, and the only mandibular teeth present are the 6 mandibular anterior teeth with the diastema between each tooth. Which major connector design is appropriate for this patient case? Option A, Kennedy's bar with modifications. Option B, lingual plate. Option C, lingual bar. And option D, lingual plate with interruptions. So what do you think? What will be the right answer for this question? The right answer is option D, that is lingual plate with interruptions. Begin with the next question. Here it goes on your screen. 53-year-old patient is found to have a hypertensive stage 2 without any comorbidity. Which drug will you start? Option A, furosemide. Option B, chlorthalidone. Option C, spironolactone. And option D, triamterene. So what do you think? What will be the right answer for this question? There is option B, that is chlorthalidone. Begin with the next question. Here it goes on your screen. Removing a mandibular lingual torus from the premolar region of a patient, the flap should have option A, only a posterior component. Option B, no vertical components. Option C, both anterior and posterior vertical components. And option D, an incision at the junction of the attached gingiva and mucosa. So what do you think? What will be the right answer for this question? So here the right answer is option B, that is no vertical component. If we placement of a vertical incision with the flap during this surgical incision of a mandibular torus is not at all necessary because of the presence of the small amount of the flap as well as in the proximity of the torus and in the lingual aspect at the floor of the mouth. Vertical incision, if we placed along the lingual aspect, are very difficult to suture due to the thickness of the mucosa. That's why it also has the proximity to the tongue and the accessibility of the incision is reduced. Vertical releasing incision are also contradicted in this condition, have the inferior concavities or bony prominences. So for this type of the condition, full thickness envelope flap with proper extension are quite sufficient to provide adequate access for the removal of the mandibular torus. The last question of this video, a 65-year-old male presented with a diabetic foot ulcer. The surgeon does the ulcer dressing and prescribed him ciprofloxacin and aspirin along with strict sugar control measure. Which adverse effect will occur due to the ciprofloxacin is the least likely among the given options? Option A, joint pain. Option B, Clostridium infection due to prolonged antibiotic usage. Option C, propensity to cause the seizure with the history of epilepsy. And option D, hepatic enzyme elevation. So what do you think, what will be the right answer for this question? The right answer is option D, that is the hepatic enzyme elevation. So that's all about the clinical question of the Neet MDS paper of the year 2019. If you still have any query, you can drop me the mail which is shown on your screen. You can also follow me on the Instagram with my name, Dr. Surabhi Sahney. Thank you for watching.